All right, starting on diseases of the circulatory system, which is going to essentially break down into two systems, which is the cardiovascular and the lymphatic system. Um, Typically, we clump these together, but again, they are usually two separate systems. We just call them the circulatory system. So the cardiovascular system is going to be made up of classically the heart and blood vessels that will carry blood throughout the body. And gentle reminder, it is a closed system. The lymphatic system, however, is going to be majorly composed of immune cells as well as fluids. I like to think of the lymphatic system as being sort of the almost the trash services when it comes to the leftovers of the cardiovascular system. There's a lot of leftover fluids during gas exchange in the capillaries that gets left over in the tissues surrounding capillaries. So the lymphatic system picks up those fluids that the cardiovascular system leaves out, essentially, that is left over in a sense. And then that fluid enters that lymphatic system, is filtered, and then goes back into the cardiovascular system. So let's talk about it a little bit more. So on that far left image, we do see the cardiovascular system kind of incorrectly phrased at the bottom as the circulatory system. That is the cardiovascular system that has the heart and all those various blood vessels, arteries, veins, and capillaries. Where in the middle, we have the lymphatic system composed of a lot of areas like the armpit and the groin, as well as the neck, where we have a lot of different nodes where a lot of lymphatic vessels will kind of congregate, and we have quite a few of those. If those become inflamed, you can have a tendency to feel those swellings, essentially, where those nodes, those lymphatic nodes, start to swell. Those vessels will swell because your immune system is responding to some type of infection, and that's a very good indicator that you are sick. And then we can see to the far right kind of those two systems working together. So let's start with the cardiovascular system, specifically that main player, the heart. The heart is going to be a fist-sized muscular organ that is going to serve the primary purpose of continually pumping blood throughout your body. So low oxygenated blood or deoxygenated blood is going to enter the heart through the superior and inferior vena cavas, where it enters that first chamber, which is an atrium or atria. And then from there, it enters a ventricle, where it is then pumped into the pulmonary vein, where it then goes into the lungs. So that blood becomes oxygenated, comes back to the heart, to another atria, and then into a ventricle, where it is then pumped really hard into the aorta. From there, it is then dispersed throughout the body. And at this point, because that blood has come back from the lungs, highly oxygenated, that is the blood that is going to carry oxygen to the various tissues within our body. And that is kind of the big take-home message and point of our heart. Now, the heart is covered in a sac called the pericardium. We'll talk about that. That can cause a few issues in the diseases that we're going to be talking about, as well as there are 3 layers that compose of the heart wall, the epicardium, myocardium, and endocardium. That leads us to the primary blood vessels. And for the most part, all I need you to remember is that there's arteries, veins, and capillaries, and they're kind of main purpose of what they do. And hopefully this is more of a review If you're familiar with this brand of A&P, if you haven't quite gotten there, then hopefully this helps you in the future. So arteries are going to carry oxygenated blood away from the heart. Veins carry deoxygenated blood towards the heart, and capillaries are where gas exchange is going to occur. Now, these capillaries, as I stated a little bit before, are where the lymphatic system kind of begins when it comes to the circulatory system. So these capillaries where we have gas exchange occurring are very, very tiny. They are the smallest vessels, and typically they're so small that only one red blood cell can fit through them at a given point in time. Now, as these tiny cells fit through these very small vessels, it causes fluids to kind of pop out of the vessels and accumulate in the tissues surrounding the capillaries. The lymphatic system is going to kind of pop up here in that it's going to pick up those fluids. So let's talk about that. So I love this image here in the middle where we see these lymph vessels running parallel along our capillaries in that capillary bed. Very important because, again, the lymph vessels are picking up that leftover fluid within the tissues. If lymph vessels did not pick up that fluid, you would just see fluid retention in those tissues, and eventually it would cause a lot of problems and inhibit our organs from doing what they needed to do, because we still need gas exchange to be occurring in those tissues. But we can't have that fluid buildup. So our lymph vessels are very important, taking away that extra fluid during that gas exchange. From there, our lymph vessels and nodes are going to filter impurities and infectious agents in areas like in those hubs that we were talking about before, like the groin, the neck, the armpit, as well as intestines and spleen. So those main areas where we see a larger congregation of lymph vessels, those nodes and glands and ducts and all those kinds of important structures with the lymphatic system. Now, if you remember when we were talking about normal microbiota when it comes to the different parts of our body, blood should be mostly sterile, as well as the lymphatic system. Now, because it is a closed system, as far as the cardiovascular system goes, there should be no normal access to any external environment. And typically, we will see that injuries will cause microbes to infect this closed system. So we have believed for a particularly long time that our circulatory system contained no normal biota. However, there may be a handful of microbes, not a whole lot, very low levels of microbes in the circulatory system. And we know this from the Human Microbiome Project, if you remember that particular organization that we talked quite a bit about, but we're still learning quite a lot. So again, for the most part, the circulatory system, so cardiovascular and lymphatic system, should be a sterile environment because it is a closed system. However, there may be low levels of microbes, but for now, we're going to classify it as being mostly sterile. So our circulatory system is pretty highly protected, and we do have a pretty strong defense, because if a microbe or a pathogen gets into the circulatory system, then it has access to every part of our body, and that is super scary. So we need to protect what is essentially a interstate, essentially, that moves throughout our entire body. So one of the biggest defenses we have is our white blood cells that are constantly moving around in our circulatory system. So we call these leukocytes. That is the technical term for our white blood cells, but that is our main immune system defender, if you want to think of it that way. So phagocytes, lymphocytes, things like that. These are white blood cells. All right, let's talk about some terms that you've probably heard of, but maybe don't understand to the fullest extent of those terminologies. So we have sepsis and the term septic shock. A lot of people know these terms, but maybe they don't know precisely what they mean. So sepsis is going to be that infection of the blood. It's when a microbe gets into the blood. Usually we're talking about bacteria. When we talk about an infection of the blood, it usually ends in emia, but then we add a prefix to it that indicates what microbe we're talking about. So if it's bacteria, it's bacteremia, which is that particular microbe infecting the blood, or viremia, which is a virus in the blood, fungemia, or septicemia. So when we look at sepsis, we're going to look at these different levels. So if we're looking at a bacterial infection, we would say bacteremia as being the presence of bacteria in the blood, where septicemia is going to be that bacteria physically growing in the blood, which is going to be considered sepsis. We're going to see symptoms in that like fevers and chills. And then from there, getting worse, we have severe sepsis, so decrease in blood pressure, possibly red streaks under the skin. We'll see this in a couple of conditions that we're going to talk about here soon, and possibly organs starting to malfunction. And then the highest level, the most concerning, is going to be septic shock. So this is severely low blood pressure that can't be controlled and the most life-threatening of the levels of sepsis. So make sure you know these different levels that will come up. All right, this starts us off with the first disease of the circulatory system, and that is malaria. Malaria is a protozoan caused by a Plasmodium species. There are 5 main species of Plasmodium that will cause malaria. These are types of protozoans, of course. So the reservoir is going to be in humans and other primates, and the transmission is going to be a vector transmission. Remember, vectors are going to be some type of, usually an insect, like a mosquito. Specifically in this case, female mosquitoes are the ones that bite us, and these female mosquitoes of this particular species, Anopheles, will carry this Plasmodium species, one of these species of protozoan, and then when they bite us, they spit into our bite, which is going to allow that protozoan access to our blood, and once it's there, well, kind of all hell breaks loose. These protozoans will inject themselves into our red blood cells, reproduce, and then explode out of our red blood cells, causing an immune response as well as potentially making us anemic. But let's talk about those signs and symptoms here on the next slide. So as I said, the protozoan is going to lodge itself into our red blood cells once it's in our system, where it then reproduces, and almost as if all of the protozoans in our body, if you're infected, time it perfectly, they all erupt out of the red blood cells all at once, causing this massive immune response, which is going to destroy those red blood cells. So what we see with some symptoms is usually malaise, fatigue, aches, nausea, chills, fever, sweating. And this is just going to kind of keep cycling. So those protozoans are going to escape those red blood cells and then go into more red blood cells, reproduce, and keep going. Now, what happens to those pieces of red blood cells that are essentially exploded out of, it's going to cause any organs that filter our blood to become clogged up. So we might see the enlargement of like the spleen, liver, possibly the kidneys, because they're just getting clogged up with all of these shrapnel of red blood cells when the protozoan explodes out of them. Now, kind of further symptoms can be anemia because the red blood cells are being destroyed, going hand in hand with that enlargement of those filtering organs. Some forms can cause cerebral malaria due to the red blood cells sticking, and it blocks blood vessels to the brain, which can result in coma and death. So kind of a bit of a scary situation when it comes to malaria. There is a vaccine to prevent malaria. However, a lot of the prevention is going to be spraying insecticides, using mosquito nets, and staying away from areas where this species of mosquito exists. And if you can't avoid it, then there is anti-malarial drug treatments if you do contract malaria. For the most part, we find this mosquito species typically kind of closer to the equator. There are certain areas where we don't see this mosquito or where we have eradicated this mosquito species, like the US. It is eradicated. However, due to climate change, we are seeing areas where this mosquito species carrying malaria is starting to move back into these areas, either more north or more south. So kind of interesting to see, due to the climate, this disease starting to make an appearance in areas where it was either eradicated or where it hasn't been before. It has everything to do with the temperature. Okay, moving into pericarditis. This is going to be kind of the start of the diseases that can affect the layers of the heart. So this is not technically a layer per se of the heart itself. It is the outside sac of the heart. So the pericardium is going to be this outermost sac that surrounds the heart. Now, the purpose of the pericardium is to be filled with this fluid that is going to reduce friction as the heart beats, because of course it has to keep beating, very important. But this area between the pericardium, the sac, and the heart, and as well as that fluid, should be sterile. There should be no microbes growing inside of that area. So if something does get in there, we are going to be talking about that inflammation of the pericardium, so the sac itself. And that can cause a lot of issues, a lot of pain, because if that becomes inflamed, keep in mind that the thoracic cavity that the heart lies within is a very specific space to hold the heart, and it's just big enough for the heart to beat within. So if you have inflammation of the sac surrounding the heart, you're making that space really tight. So you're going to have shortness of breath, chest pain, fatigue. The microbe that we usually see causing this inflammation and these signs and symptoms is usually viral, but it can be fungal, parasitic, or bacterial. But the one I want you to know is viral, typically. Now, the treatment that we use for this is usually anti-inflammatories to bring that inflammation down, as well as to treat those symptoms. Let's move a little deeper into the heart. So if pericarditis is that sac surrounding the heart becoming inflamed, we want to go deeper into the heart. Endocarditis, that is that inner layer of the heart becoming inflamed. So we talked about that most external part surrounding the heart, not technically part of the heart, but surrounding the heart. Endocarditis is the inner layer of the heart wall, the most central area, becoming inflamed. Now we have two types of endocarditis, acute endocarditis and subacute endocarditis. Remember that with subacute, that means that it's quick, it comes on suddenly, and subacute means it's a little bit slower to come on, but the symptoms for both are mostly the same except for a handful of things. We'll talk about it. This is mostly going to be caused by trauma to the heart, but let's jump in to the different causes of endocarditis and some of the differences between the signs and symptoms first. All right, some signs and symptoms that we need to talk about. Again, a lot of these are the same. However, I will point out where there are some differences, and there are a ton of different signs and symptoms when it comes to endocarditis, and that makes sense because we are affecting the heart, which you can see a lot of different problems arising because of hurting the heart, essentially. But the big one's going to be anemia for both subacute and acute endocarditis. Petechia, and this one's going to be a little bit easier to kind of notice when I show you a picture, but petechia is going to be a discoloration that is red or purple of the fingernails, typically. So I would maybe make a note here too that petechia can be caused by just about anything, and just because a patient or yourself have petechia does not immediately mean endocarditis. It could mean 100 other things, but if it is paired with some of these other symptoms, then it's a good chance that we are looking at endocarditis. Next is Janway lesions. These are going to be spots on the palms or possibly the soles of the feet. They are usually painless. And then Osler nodes. These also kind of go hand in hand with the Janway lesions. These are nodes on the fingers and toes. Again, these will look a lot more or will be easier to identify when I show you a picture. Now, let's get into kind of a difference here between subacute and acute. With subacute endocarditis, we can have enlarged spleens. Again, we're talking about these areas that filter blood. So the spleen is going to be a big one. And then Roth spots. That is going to be hemorrhaging in the retina. So you would have to look in the back of the eye and identify blood vessels that have exploded, essentially. And I do have some pictures of some Roth spots. And if endocarditis is persistent through the years, you might see clubbed fingers and toes. So let's take a look at some pictures. All right, so that fingernail, we are seeing petechia on that fingernail, that discoloration, kind of purpley red. In that upper left image, we are seeing the retina, the back of the eye, and some Roth spots. Those are areas where we have hemorrhaging of the retina. And then we have Osler nodes, Janway lesions, and then that clubbed fingers. Again, club fingers and toes are going to be endocarditis that is persistent through quite a long period of time. All right, here is acute endocarditis, typically caused by bacteria. The causative agent that I would like you to know is Staphylococcus aureus. That is the most common causative agent as far as bacteria goes. You'll notice that this guy is part of our home team. So the reservoir is humans. Transmission is direct entry via an injury, which kind of makes sense, as well as maybe intravenous or subcutaneous needle use or surgical procedures. So essentially, this normal microbe that we have on our skin gets into our blood and makes its way to our heart and causes this sudden inflammation of that inner layer of the heart. So this is kind of an unfortunate situation that it usually happens in hospital settings, but kind of just the way that it is. The prevention is usually with individuals that are kind of high risk, or maybe they're immunocompromised, but we know they're getting a surgery. We may give them antibiotics prior to getting the surgery to prevent them from developing this acute endocarditis, just in case they get the Staphylococcus aureus into their system. So preventative measures is kind of the big thing here. So treatment may be antibiotics or maybe surgery if it comes to that, if there is too much damage to the heart. Moving on to subacute endocarditis. This is going to be pretty much any microbe type except for a virus, mainly bacteria, but sometimes fungal or protozoan. The causative agent I want you to memorize is going to be the alpha hemolytic streptococci that we're going to find in the oral cavity. Now, this is kind of where it's normally found. It's just if it moves to a spot like our blood, that it becomes a problem, and how it gets there is kind of odd. Now, keep in mind that if it's part of our home team and it goes to an area where it shouldn't, we call this an endogenous infection. We're essentially infecting ourselves with our home team. So the transmission sometimes happens if you brush too hard or aggressively, or you're flossing or water flossing, or you're at the dentist and the dentist goes a little too hard. But essentially, disrupting your skin or mucous membranes in your mouth, and then that alpha hemolytic streptococci bacteria gets into our bloodstream. So prevention is usually just going to be the suggestion of good oral hygiene so that you don't have those aggressive teeth cleanings. But that's kind of the big one here. The treatment might be a combo of antibiotics, possibly surgery. It just depends. Now, the reason that this particular bacteria is kind of such an issue is that it has essentially a blood-killing toxin found in it or on it. And that's why it's kind of a particularly nasty bacteria to get into our blood, because it can kill our blood cells. Okay, that takes us into rheumatic fever. This microbe type is going to be a bacteria, which is Streptococcus pyogenes. But the weird thing about this one is the causative agent isn't necessarily the bacteria itself. It's our body's response to the infection caused by the bacteria. So it's always complications of our immune system. So the reservoir is humans, the transmission is respiratory droplets, and specifically what happens is we have this infection of potentially maybe strep throat, which we'll be talking about actually in the next chapter for the next unit, so stay tuned. So potentially strep throat happens, and when you have strep throat, which is usually caused by this bacteria, what you are given to treat the bacteria is antibiotics. And a lot of people, unfortunately, do not take antibiotics the way that they are prescribed or instructed to. So what happens is, to treat the strep throat, the antibiotics are not taken properly, and this leads to our body responding with antibodies that we make for the bacteria, but because the antibiotics are not taken properly, hand in hand with our immune system is starting to respond, our body ends up attacking our own cells. So this can cause issues with our heart, joints, our brain. It can lead to heart disease, especially among children. So that's kind of the big thing here. So prevention is long-term antibiotics for high-risk individuals, and then treating strep throat very quickly because we want to prevent that autoimmune complication. So treatment would be monthly penicillin injections to prevent reactivation, and possible surgical replacement, which let's talk about that on the next slide. Now, when we look at the signs and symptoms of rheumatic fever, this can include inflammation of the heart valves, which I've got a lovely image on the next slide showing the heart valves, and I'll explain this again, I promise. But essentially, if these valves become damaged, then they don't really repair themselves properly. And I want you to think of this like essentially a valve on a pipe. If that pipe is constantly being flushed with water over and over, and the valve on the pipe is constantly being used, it'd be very hard to go in there and try to repair it, or for that valve to correct itself if it is constantly being used. And that's what's happening with our heart. We have four very important valves. You don't have to know them, just know. Well, you probably have to know them for A and P, but for me, you don't. But know that there are four very important valves that can't repair themselves properly if they are damaged. And this rheumatic fever can cause inflammation of these valves and thus damage to the valves themselves. And that is why we might need surgery if it comes to that, if these valves become so damaged beyond repair. Alrighty, so here are those valves. So we have those four very important valves again. If we have that inflammation happening, it's not dissimilar to kind of like shingles on your roof, kind of fighting against very strong winds that over time, well, the shingles kind of lose. So if we already have this damage happening due to this inflammation, these valves are not going to withstand this constant pressure of our blood moving through the valves. And that is kind of their whole purpose and point, is to close off chambers and make it to where blood is moving through the heart and thus pushing and squeezing hard enough in those chambers to move throughout our entire body. So there's a lot of pressure that is going against these valves. So if they're already inflamed and kind of susceptible to damage, then that pressure is going to be even more difficult and potential in causing these damages. So potentially, if this rheumatic fever causes this inflammation to these heart valves and more issues, you may have to get surgery to replace your valves of your heart. Naturally, we are moving on into the plague. So this term plague is kind of a misnomer, I think, in that you might consider that there's been multiple plagues, and oh, maybe it's been caused by different things. The answer is actually no. The plague is one thing. Plague itself is the disease. So the microbe type is actually a bacteria called Yersinia pestis, and the reservoir is usually some type of rodent, like rats or ground squirrels, chipmunks, and prairie dogs. So the transmission is through vector transmission of this particular species of flea that lives on these rodents. Now, the rodents carry the infected fleas to somewhere where people are, and then the fleas jump onto the people and then bite the people, and then people get this bacteria. So animals can also be infected with the bacteria, like house pets can also contract the plague. The biggest prevention is just avoiding the fleas and the animals that carry the fleas. Where we see a lot of people contracting the plague is from hiking in national parks. There are a handful of populations, I think, of groundhogs or prairie dogs. I think it's prairie dogs that still have these fleas that have the bacteria Yersinia pestis. So if you're in a national park and a little chipmunk or a prairie dog or something comes up to you because they have gotten used to people because people feed them, maybe just don't be one of the smart ones at a national park and don't have your Disney princess moment. Because you probably should stay away from that animal, potentially if they have one of these fleas that is containing the plague. Don't want the plague. And let's talk about what happens if you get the plague. There are 3 possible manifestations of the plague, and this is kind of, I think, where that misnomer of there are different plagues that can happen is because of the manifestation of the symptoms. So the first one is actually the one that you want, because it's the easiest one to fix and the easiest one to come back from. It is the bubonic plague, which is probably the one that you know of. This is the plague that we would know of as the Black Death. And you'll see why when I show you some images. So what happens with the bubonic plague is that the bacteria will grow in the blood and also in the lymphatic vessels. And what causes these things called buboes is the swelling of lymph nodes cutting off blood, and it creates these giant black swellings because the blood is essentially just pooling and dying in these areas. And again, I'll show you a picture here in just a little bit to show you what buboes look like. Now, it looks horrible, but again, this is the one you want because it's the one that we can fix, essentially, if we catch it in time. Now, the next one is pneumonic plague. This is where the bacteria starts growing in the lungs. Unfortunately, it is 100% fatal. It causes pneumonia, but this is definitely one you do not want. Even if we start treating it, there is pretty much nothing we can do. We have septicemic plague as well. So this is going to be a progression of the other two with massive bacterial growth in the blood specifically. But we're not going to see those buboes potentially, but we do see coagulation of the blood, maybe subcutaneous hemorrhaging, blood spots, maybe necrotic areas of the tissues, and maybe gangrene at the extremities. Now, with treatment, there is still up to a 50% chance of fatality. However, without treatment, septicemic plague is 100% fatal. So there's still a chance you could die, pretty good one. But with treatment and in time, if you catch it in time, you could probably come back from that third one. But bubonic plague, that's the one you want. If you get any of them, of course, which avoid if you can. So again, I'm going to show you a picture here of the bubonic plague. It is not the prettiest of pictures, so just bear with me. Alrighty, here is the bubonic plague. We get these really cute buboes. So remember, that is just severe swelling of the lymph nodes that causes the blood to not be able to flow through those areas and creates essentially these almost blister-like projections of the blood underneath the skin. So again, it looks horrendous. However, this is the one you want because it's the one we can treat. At least the best. Treat it the best, have a higher chance of recovery. Scooting right into rabbit fever, also called tularemia. This is caused by the bacteria Franchilessa tularensis, and I could have pronounced that absolutely horribly, but maybe some of you know that, maybe some of you don't. Who cares? That's the causative agent. It is a bacteria that we find primarily in rabbits. However, it can be in other rodents, maybe other mammals, but this is where it gets its name because we find it primarily in rabbits. The prevention is there's no prevention, just kind of avoiding rabbits that potentially have this bacteria in them, I suppose. There is treatment as long as you catch it early enough. However, we're going to talk about why it can be a little bit difficult to treat. So just bear with me. Let's talk about the transmission. Rabbit fever is often considered the most infectious disease because you need so few cells to actually become infected with tularemia. So historically, if someone caught this condition, it was from skinning rabbits that were infected with this bacteria. Now, the way that we do see the transmission primarily nowadays is one of maybe roughly two ways. One is typically tick bites. So tick bites a rabbit, and then that tick ends up biting us. From there, we're infected with the bacteria because ticks can carry the bacteria from the rabbit. When they bite us, they're spitting into us as well, kind of insult to injury, super fun. The other way that you can contract tularemia nowadays is accidentally running over maybe a nest of bunnies. I know that's horrendous to think about, but think about like if you're mowing your lawn and accidentally not seeing little nests, because mama bunnies do hide their babies kind of in burrows. So potentially running over the baby bunnies, and then you get this spray of blood mist, essentially. Or maybe your dog catches a bunny and is doing what dogs do and kind of rips it apart as if it were a toy. But essentially the blood gets somewhere where you inhale it, or it gets into your system or something like that. But again, it takes very few cells of the bacteria to actually cause that infection. All right, some signs and symptoms. We can see a headache, backache, fever, chills, coughing, weakness. Potentially at those portals of entry, words are hard, maybe ulcerative skin lesions, swollen lymph glands, conjunctival inflammation, sore throat, intestinal disruption, pulmonary issues. Kind of just depends on where the infected material got into our system, or if there was a tick bite or something like that. However, here's where the issue lies. This is a very difficult condition to diagnose because a lot of the early symptoms are super vague, kind of almost seems like a cold or like 100 other things. And that is why this particular condition is kind of deadly in that it can be misinterpreted and it delays the treatment in correcting the problem. So the death rate is 30%, but with timely and proper treatment, it's almost zero. However, again, the symptoms make it very vague as to what it is you're sick with, so sometimes we don't catch it in time. We were talking about tick bites just a second ago. Let's keep talking about them. Lyme disease. We get this from tick bites that formerly the tick was on a rodent, something like a tick on a deer mouse or a wood rat. They're the same species, but they're called either of those terms. Is it a mouse? Is it a rat? Who knows? But what this particular rat or mouse is carrying is a bacteria, Borrelia burgdorferi, which is a super fun word to say. I highly recommend it. And then the tick gets the bacteria from consuming the blood of those rodents. Now, from there, the transmission is through the bite of this tick. And for prevention and treatment, there is a vaccine for people who maybe are more at risk. So most people probably don't get it. Maybe if you do a lot of hiking in areas where Lyme disease is more popular, maybe you'd get it before going hiking a ton. But there are antibiotics to treat it. But it's very hard to diagnose. Let's talk about why. There are different phases of Lyme disease, which a lot of these phases have symptoms that make it difficult to identify because the first one is the most identifiable phase, to be perfectly honest, but it's also not super common as a symptom and it lasts for a very short period of time, which potentially this is the one you know of when it comes to Lyme disease, and that is the bullseye rash. However, it only pops up in about 10% of cases, so it's not common enough to really make it perfectly identifiable. Usually people move into that second phase with irregular heartbeat, encephalitis, maybe facial palsy, which depending on where the microbe lands, it could cause different symptoms. And then once you're into that third phase, you get arthritis, which seems kind of rude for a disease in particular, but hey, there it is. The issue here, guys, is that these symptoms look like 100 other symptoms of 100 other diseases. So potentially by the time your patient gets crippling arthritis and you're like, oh, it's Lyme disease. Well, unfortunately, now the damage is done. That person is now left with arthritis for the rest of their life unless they get a knee replacement or a hip replacement or whatever to try to fix that damage. But even once this individual starts getting treatment at this third phase, they are now stuck with arthritis. Whatever damage has been done by that disease doesn't go away because we start treating the disease. That's kind of the issue here. All right, I got a picture of a creepy crawly for you, and he is perfectly centered over one of those bull's eye rashes. Again, keep in mind that only about 10% of cases even show this symptom. It's not a common one to find when it comes to Lyme disease. However, here it is. That's kind of the big one to look for with Lyme disease, but it doesn't happen that often. All right, pucker up because it's time for infectious mononucleosis, or mono, or the kissing disease. The microbe type for this one is a virus. It is the Epstein-Barr virus, also known as the herpes virus 4 or HHV4. So that is what I want you to know for the causative agent with this particular disease. The reservoir is humans. Transmission is direct oral contact with contaminated saliva, possibly through blood transfusions, sexual contact, which we'll talk about this in just a second, kind of silly, and organ transplants. Now, the reason why I say sexual contact's kind of silly because, well, when it comes to sexual contact, you're probably kissing and swapping spit. So yeah, sexual contact probably fits in here, but it's probably not the actual contact of sex organs. It's probably the kissing that happens during intimate moments that is causing that transmission. So either way, just know that's going to happen. So if someone's playing tonsil hockey with another person who is infected with mono, there is a wonderful chance they're going to contract it. However, we have seen mono move from mom to baby. So across the fetus, across the placenta to the fetus is also possible. Also a reason not to kiss babies and get your spit all over them. Because we can even see that in little babies as well. Ones that are out of the womb, not just in the womb, but also out of the womb. And then prevention and treatment. There is no true prevention, just not smooching on people who are sick with mono, I guess. And then treatment is just treating the symptoms and trying to make someone comfortable as they go through this because it is a virus. Once you have it, not a whole lot we can do. The biggest symptom that we can identify with mono is usually a lot of white blood cells after a long incubation period of about 30 to 50 days. Small children and adults are usually asymptomatic. The ones we gotta worry about here is usually teenagers, oddly enough. Usually what we see with teens is swollen lymph nodes, tonsils, sore throat, a rash, swollen spleen, fatigue, fever, headache, gray or white pus in the throat, maybe a skin rash, and possibly enlarged liver and spleen. Now, let's talk about a few of these symptoms. One, I've got a picture of that real sexy pus developing on the tonsils. And again, if you're a teenager, and we know teens, full of those raging hormones, are probably trying to smooch everybody and anything, right? Now, if you've got this real sexy pus going on in your throat, you probably shouldn't be smooching anybody. But yeah, there's that. And in fact, speaking of their raging hormones, that might be why teenagers exhibit more symptoms than children and adults, having to do with maybe their hormones. We're not entirely sure. We really don't know. And then kind of the big thing here, aside from the pussy tonsils, is the enlarged filtering organs. So enlarged liver and spleen, these are going to be the organs that filter, and they're going to catch particles of the virus. So they're going to become enlarged and swollen from those particles. All right, scooting right into Chagas disease, or American trypanosomiasis, which I think I said that right. We'll see. So the microbe type is a protozoan. The protozoan is called Trypanosoma cruzi, and it lives in, oddly enough, moving from the kissing disease to a kissing bug. So that's where this protozoan likes to live, in this particular type of bug called a triatomine? Whatever, no, it is a kissing bug. That's fine. But the transmission is the bite from one of these kissing bugs. Now, we can see transmission through blood transfusions with infected blood as well, but typically we're going to see that vector transmission. Prevention and treatment, there is no vaccine that exists. However, lower bug populations through pesticides treatment is most successful in the acute phase of Chagas disease, but that is particularly hard to diagnose, which makes this one of the, and this should say 9, I know it says 5, but it should be 9 neglected parasitic infections in the US. So unfortunately, Chagas is not as treated as it should be, because it is hard to diagnose. There are 2 distinct phases of Chagas. The acute phase, which we can see a possible chagoma, which is a swelling of where the bug bite is. We can also see Ramona's sign, which is a swelling of the eyelids or possibly drooping of the eyelids. This acute phase, remember this means it comes on suddenly, will eventually go away, but it means that the microbe is just moving to deeper tissues, and you'll end up feeling fine for a while until you don't, which will typically end up maybe getting worse later, because again, that protozoan is moving deeper once we end this acute phase, because you start feeling better. And this can last for weeks or months. Then we have the chronic phase. This is the long-term phase. You can be asymptomatic for years, possibly indefinitely. That doesn't mean it's gone. It's just, it's kind of more or less dormant, but you're just asymptomatic. Eventually the microbe is going to be throughout the entire body, and it can cause inflammation, disruption of organ functions in the heart, brain, and intestines, which can be pretty bad. So I've got some pictures of these chagomas and Ramona's sign. All right, we can see that swelling on image C and D, and then that eyelid swelling and a little bit of drooping there for Ramona's sign on A and B, and that is Chagas disease. Remember, we get this from a kissing bug, a little bite from a bug. All right, I have two more diseases for you. However, we have clumped multiple diseases into one essentially big category. So we're clumping a lot of these together, and I just want you to understand them as overall hemorrhagic fever diseases. And then we also have non-hemorrhagic fever diseases. We'll talk about that one in just a little bit. So this first category, hemorrhagic fever diseases, there are three things I want you to understand about this particular category. One, the title is telling us the symptoms. The symptoms are built into the name. We have hemorrhaging, so bleeding, and there is a fever. So it is bleeding fever diseases is what we're saying. So that's the first thing I need you to know. The second thing is what diseases fall under hemorrhagic fever diseases. So we've got, and I'm going to try to say these, I've tried to say this before and they can be kind of hard. Yellow fever, dengue fever, chikungunya fever, Ebola, Marburg, and Lassa fever. These are all caused by viruses. That is now the third thing I need you to know. So I need you to know the symptoms, which is in the name, hemorrhagic fever disease, the diseases here that I have listed on this slide, and then the third thing, that there are viruses, or that these are viruses. They're caused by viruses. Now, unfortunately, because these are viruses, there's not much we can do about it. However, we do have vaccines. For like Ebola and yellow fever, we do have vaccines, but we don't see these particular diseases, these viruses, usually in the US. But, you know, people travel. So maybe you go to an area, you accidentally come across someone or something that has this virus, and you contract the virus and bring it home. The good news is there are a handful of things we can do to treat some of these conditions, but for the most part, unfortunately, for like something like Ebola, if you didn't get the vaccine and you contract Ebola, really it's just palliative supportive care to make you comfortable while you bleed out of every hole. And I don't know off the top of my head what the mortality rate of Ebola is, but I can't imagine it's good. So that's why we have a vaccine. Essentially, we are hoping you don't die if you contract one of these diseases, because again, they're viruses. There's not a whole lot we can do. Just make you comfortable. Moving on to non-hemorrhagic fever diseases, meaning no bleeding, but there's still a fever. So make sure you know that about these guys. The second thing is the diseases. I'm not going to try to say these because I'm going to get tongue-tied. The two that I recognize, and you might too, because we find them in the US, is cat scratch fever and Rocky Mountain spotted fever. So essentially, we probably don't know about the rest of these as well. Maybe you do. Super love that for you. Because we don't typically have them here in the US. Now, they are all caused by a bacteria, except babiosis, sure, which is caused by a protozoan. So I would make sure you know that as well. Mainly bacteria, except for that one. The good news here is that because all of these are not viruses, we can treat them. Treatment and prevention do exist for all of these guys, either in antibiotics or anti-protozoans. We can treat them. They say time flies when you're having fun. That is the end of this unit. That is the end of this chapter as well. I hope you enjoyed it. Make sure to be studying using flashcards. I think that is the best way to study for this particular unit because it's all memorization. Remember, you can always reach out to me if you have any questions at all. I am happy to chat. Happy studying. Make good choices.